Welcome to this interdisciplinary collaboration presentation. In this video, we will be discussing how combining the efficiency of electronic health records with utilizing an interprofessional lens will improve chronic disease management by reducing disparities in care, improving patient safety, and finally, improving the ease of decision-making by healthcare providers by establishing a common ground.
Chronic disease management, identifying and reducing disparities. Care disparities can be reduced in the management of chronic disease with interdisciplinary health records through tracking care provided to each patient by each provider, meaning appointment status, routine testing, recall notices, etc. can be monitored by all. Interprofessional electronic health records will help to improve the referral process between practitioners through streamlining the process and providing the referred provider with immediate access to pertinent health information. Electronic health records could generate patient registries for shared diagnoses, meaning that one has immediate access to population information in the instance of public health outbreaks or knowing patient outcomes in chronic disease management. Collecting data in a meaningful way will help provide information regarding access to care for similar patients. Through these measures, utilizing electronic health records in an interdisciplinary way will benefit all health stakeholders. We will explore each of these topics in the next few slides. Studies have found that people with multiple chronic conditions are more likely to be hospitalized, see a variety of physicians, take several prescription drugs, and be visited at home by health workers. Furthermore, poor coordination of care has been associated with poor clinical outcomes, such as unnecessary hospitalization, duplicate tests, conflicting clinical advice, and adverse drug reactions. That's from Burton, Anderson, and Hughes. According to a 2011 conference of the CDC, interdisciplinary electronic health record management systems can issue warnings and reminders for tests that have or need to be done or prompt providers for recall visits or possible medication interactions when a new medication is put into the system, as well as track immunization records. This also means that routine blood work and other testing will be flagged when it needs to be performed, and the next care provider can make the necessary arrangements or get in touch with the appropriate care provider to have arrangements made. Burton, Anderson, and Hughes suggest that multiple chronic conditions can be addressed through a common health record. There is much information suggesting that improper care coordination causes the greatest discrepancies in health outcomes for those with chronic diseases. Burton, Anderson, and Hughes continue that this type of systemic integration allows care providers to see a person's pharmaceutical history, allergies, list of conditions and/or signs and symptoms, visit history with providers, images and diagnostic reports, functional status assessment, social service information, schedule of preventative services, as well as the contact information for all care providers and family caregivers. The current siloed system, where each practitioner in each location keeps their own health records, sometimes electronic and sometimes paper, can be frustrating for the patient and for the practitioner when it takes extra administrative time to coordinate care and is more likely to have time delays or seeing our patients slip through the cracks. Despite some support by technology, Govet suggests referral communication between primary care providers and specialists or other professionals is often unsatisfactory and is unable to eliminate care delays. Most electronic health records will capture referral information within the patient's record, but there is no immediate way to transmit it out to the specialist or for the specialist to transmit diagnosis, treatment, or results back to the referring physician. This causes a break in the care continuum because the amount of time spent preparing the referral documents and sending them out elongates wait times. Additionally, we are often relying on the patients to transmit the information provided to them from a specialist or other care provider to whom they were referred back to their other care providers, which is frequently unreliable. Esquivel et al. Recommend the inclusion of real-time clinician-to-clinician communication features, the use of standardized referral templates that include both structure and free text fields, bringing healthcare providers together to collaboratively develop referral guidelines for inclusion into the electronic referral system, and the use of automation to pre-populate electronic referral requests with patient-specific data. This will close the communication loop by providing referral status tracking and feedback capabilities. It will improve accountability of the healthcare providers in the circle of care and will allow the healthcare providers to see referral status so that different providers aren't referring to other different providers for the same services. This will ultimately lead to a limited need to rely on the patient for information transmission. Clinical practice guidelines surrounding chronic pain management involve biological, psychological, social, and environmental factors. Multidisciplinary best practice guidelines are needed to address these issues in a holistic way. Ernstein et al. Believe that since chronic disease prevalence is high and increasing, stakeholders in healthcare must address evidence-based treatment guidelines in a cost-effective, context-specific way. With this in mind, practice guidelines can be used to emphasize non-pharmacological strategies that are rooted in evidence for the treatment of chronic conditions, as well as identifying personal risk factors for developing chronic conditions. Including demographic information like location, age, culture, and the social determinants of health in practice guidelines on the electronic health record will help provide identifying risk factors that can be included in registries of patients with shared diagnoses. The CDC suggests that registries could easily include average blood pressure, smoking, alcohol, or drug use status, BMI, comorbidities lists, medications lists, as well as lab data, and track the trends over time. There are several sources for data collection in healthcare outside of the electronic health record. Genomic databases, medical monitoring devices, wearable and mobile devices, and public health repositories that can be incorporated into the common health record. Meaningful use of data collection will be elaborated on further later in this presentation. Containing shared patient data from all treating professionals into an electronic health record can help fill holes in patient information that might be missed, as well as sharing symptoms, conditions, and effective treatment plans with each other and public health services. When interprofessional guidelines are set electronically through data collection and meaningful use for teams to use, we can hypothesize that this will generate optimal patient outcomes. For example, if a patient sees their physician and is diagnosed with cardiovascular disease, their chart will include their average blood pressure, smoking use, BMI, signs and symptoms, medications, and lab data. From this, the dietitian that they will be referred to does not have to take the extra time to measure and chart this same data. The information is provided to them on record, which will save time and resources. Next, when the patient returns to their physician, they can see what the dietitian has recommended and look into compliance. If this data is shared with public health, they will be able to better address the demographics and see trends within the registry for their preventative health information.
Medicine's a team sport, and every member of the team does their part. And they're going to do it differently. The dance is going to be different when you have an electronic health record that can really help manage that process and have every member of the team, the front office person, the medical assistant, the nurse, the physician, and the patient do their part in a way that gets someone through the process as quickly, as efficiently, and with as much quality as possible.
Electronic health records benefit patient safety. The World Health Organization 2018 defines patient safety as the prevention of errors and adverse effects to patients associated with healthcare. Increasingly, healthcare organizations treat sicker and older patients with comorbidities, also known as chronic care patients. This can lead to an increase in complications and difficult decision-making with regards to care. In order to properly address these patients, collaborative, team-based healthcare is needed to meet the increased burden of chronic disease with the aging population. Wagner 2000, VanWiechen 2018a. Casto and Julia, as cited by VanWiechen 2018c, outline how individual healthcare providers' unique knowledge, skill set, and problem-solving frameworks can create barriers to delivering the most effective care for patients, and barriers to interprofessional collaboration. Electronic health records can aid interprofessional collaboration in improving patient safety in a number of ways. Increase in healthcare outcomes and quality due to electronic health records. Electronic health records improve patient safety within interprofessional collaboration by increasing healthcare outcomes and quality. A 2010 study conducted by the Office of the National Coordinator for Health at the University of Chicago revealed open-source electronic health records within a chronic healthcare environment improved diabetes management, helped to control hypertension, and increased tuberculosis vaccinations, particularly in an environment conducive to patients that have received poor chronic disease management due to low income and transitory status. Prevalence rates for these diseases decreased and care teams were able to provide more individualized and effective care, leading to a decrease in adverse events to patients. Goldwater et al., 2014. Similarly, a report of diabetes care management outlined healthcare system approaches to improving care quality and found that systems, processes, and tools within an electronic health record allowed data to be linked across various professionals, such as lab, pharmacy, inpatient, and outpatient departments, which in turn helped manage individual care and decrease adverse patient outcomes. Kurakov et al., 2012, Schmidl et al., 2017. Once again, another study found the use of electronic records versus traditional paper records enhanced the ability to provide safer, high-quality diabetes population care, which led to a decrease in adverse patient outcomes. Vagefi et al., 2016. Furthermore, evidence outlines that diabetes complications are reduced when addressed by a multidisciplinary care team. Krishnan et al., 2017. When multidisciplinary care team members utilize effective electronic health record tools, these diabetic healthcare outcomes are improved even further. Rushton, 2015, Schmidl et al., 2017. Timely access to health information improves patient safety. Electronic health records improve patient safety within interprofessional collaboration by providing timely access to health information. Without timely communication of information, including tests, test results, and medications prescribed, leading to an improved coordination between various healthcare providers, the continuity of care for a chronically ill patient is not optimal. With improved access to a patient's records and knowledge of best medical practices, providers spend less time searching for information and more time with patients, leading to safe, quality patient care. Anderson and Nickman, 2001, U.S. Department of Health and Human Services, Agency for Healthcare Research and Policy, 2009. Research suggests when electronic health record systems are easy to use, improve time management, and integrate well with the workflow of the clinical environment, quality of care is improved. Harrison, Koppel, and Barlev, 2007. This is paralleled with a case study from Shah et al., 2011, where providers reported ease of information retrieval and gathering of information led to increased time spent with patients. Time with patients is seen as a key indication of quality care improvement due to increased patient-provider communication and increase in information accuracy due to point-of-care information input, therefore increasing patient safety. Harrison et al., 2007, and Salim et al., 2005. Improvement in time management also decreases healthcare overload, additionally contributing to increased patient safety outcomes. Harrison et al., 2007. Electronic health records decrease medical errors. Electronic health records improve patient safety within interprofessional collaboration by decreasing medical errors in a number of ways. A 2015 study examining 209 primary care practices over 4 years analyzed the use of paper charting versus electronic health records, with results demonstrating significantly higher rates of workflow, policy, and practices that promoted patient safety in the use of electronic health records when compared to paper charting. Tanner, Gans, White, Nath, and Pohl, 2015. This was to be expected with medication management, but also showed statistically significant results in other patient safety practice areas, such as 1. During patient handoffs and transitions, such as tracking consultations and imaging test results, medication communication, and cross-setting communication where the electronic health record system allowed. 2. The monitoring and confirmation of personal qualifications and competencies improved with electronic health records versus paper charting. 3. In practice management and culture, the electronic health records outperformed paper charting when it came to patient instructions on use of devices and an overall culture that emphasized staff patient safety. And finally, 4. The use of electronic health records versus paper charting showed higher rates of translation services provided to patients for whom English was a second language. Tanner et al., 2015. 2 other studies demonstrated similar findings that electronic health records facilitated coordinated care better than paper records, allowing for quality measurement and reducing medical errors. Hillstad et al., 2005, and Murray et al., 2011. All of these instances are related to a decrease in overall medical errors and an increase in patient safety, and help to facilitate interprofessional collaboration. In fact, this idea is reflected in a 2010 study conducted by the Office of the National Coordinator for Health at the University of Chicago, which revealed open source electronic health records within a chronic healthcare environment allowed optimal use of various healthcare providers' knowledge. Goldwater et al., 2014. Electronic health records are the future of patient safety in chronic care delivery. Reeves, Lewin, Espin, and Zworenstein, as cited by VanWiechen 2018a, states that the shift from acute to chronic illness means people are living longer and there will be an increasing need to address the complex chronic conditions among the aged. Douglas et al., as cited by VanWiechen 2018a, outlines the coordination of various comorbid conditions among patients will require enhanced interprofessional collaboration. Electronic health records have shown adaptable, measurable, and statistically significant improvement in patient safety outcomes through an increase in overall healthcare outcomes and quality, timely access to healthcare information, and a decrease in various medical errors. Electronic health records have a place in the present and ever-evolving healthcare future to continuously improve patient safety.
Finally, we will discuss how electronic health records aids in improving decision-making for healthcare providers by establishing a common ground. Firstly, electronic health records are beneficial to patient handoff. This can be accomplished by effective use of clinical information. With the use of electronic health records, more disciplines have access to clinical information, leading to increased access, which improves evidence-based decision-making. Clinicians can establish a common ground, reviewing information in the health record and exchanging important information. Electronic health record is extremely useful for both the patient and healthcare team during patient handoff, which helps in decision-making and disease management. Patient handoff is an important component in medical care and in patient care and safety. It is important for accurate information to be relayed about a patient to each of the health providers involved in their care. Lack of communication has been the most common cause of preventable errors. The main idea of handoff communication is to establish a common ground or have a mutual agreement of patient's information between all the health providers during the handoff period who are responsible for that patient. Various health providers are able to get up-to-date information on patient history, including tests and recommendations from other clinicians, which promotes effective collaboration. The handoff information that is passed to the next provider during the interdisciplinary handoff will promote collaboration and aid the clinicians in creating a precise plan in regards to their discipline that supports the interdisciplinary team's overall goal. In addition, it will result in reduction of information loss and interruptions and errors of omission. Shared decision-making plays a key role in managing diseases and is a key approach in medical care. Shared decision-making model is based on the interaction and communication between a patient and provider, which can aid in contributing to clinical decisions in unique ways. Patient and providers both engage in a discussion where the patient is made aware of their health outcomes, given clarification on tasks, and is educated by their provider. The provider increases their knowledge about risks and benefits. It is based on the collaboration between the provider and patient, which enables them to make the best possible decision due to sharing. Shared decision-making can be hard to carry out in a routine practice, but with the addition of electronic health record, it provides a comprehensive overview and is beneficial for both. Shared decision-making places emphasis on patients' values and preferences, whereas electronic health records contain data that may be based more on patient engagement. A four-step approach of the shared decision-making procedure was created that can be applied into the clinical system. Electronic health record and shared decision-making both go hand in hand to ensure quality healthcare with the integration of these four steps. First, recognizing context for shared decision-making. Second, discussing the many options for care. Third, deliberation between the patient and provider on the pros and cons of the treatment. And lastly, considering the care patient receives complies with the preferences. For the first phase, it involves an info button, which is a computer software which allows electronic health record to convey patient information in the clinical context of any patient. The second phase involves patient learning their options for their treatment. Third phase involves the patient and provider deciding on a treatment together and to deliberate. They also believe that decision aid should be similar to a diagnostic test, meaning it should have specific actions. Lastly, in order to ensure that patients' preferences are respected, a system that encodes their preferences should be easily displayed on the computer system.
Information is power, and information allows you to appropriately manage the patient.
Access to information is key in terms of making good decisions for patients.
Lorsqu'on a accès de façon instantanée à ces informations-là, on peut accélérer les prises de décision.
It's a portable, accurate record that many different healthcare providers can access.
They'll go at 9 o'clock in the morning, they'll have their blood drawn. By 10 o'clock, the result will be on my screen. So that's a huge improvement.
And in fact, the opportunity for us to actually use that record to dialogue with the patient is fantastic.
As a pharmacist, it's nice that you get to collaborate with the doctor, share things with the doctor, and they share things with us.
I think it can only lead to better things in healthcare, quite honestly.
So it really provides us with something that we should have had a long time ago.
This video illustrates how the various providers find EHR useful in making decisions, better managing care of patients, and also enhancing communication between provider and the patient. By sharing information among members of a healthcare team, it results in shared decision-making. All healthcare providers should have knowledge about the roles and problem-solving styles of each of the professions involved. All in all, it is essential for team members to be familiarized with the cognitive maps of other disciplines in the team. Clark describes cognitive map as modes of inquiry and understanding, observational and explanatory methods of other disciplines, and problem definitions. The use of big data presents numerous advantages and opportunities in the healthcare setting. In the healthcare industry, big data is electronic health data, which is complex and consists of various information which is difficult to manage with traditional data management tools. The entirety of data that involves patient information and well-being is involved in the big data in the healthcare sector. Better outcomes are associated, such as examining patient and characteristics, costs, and positive care outcomes to determine the most cause and clinically effective treatment. With big data, many questions can be solved and addressed, such as identifying diseases before they develop and become more serious, where it can be treated more efficiently. Approximately $300 billion can be saved each year in the U.S. healthcare because of this. Big data helps the decision-making process with providers more faster and straightforward. Since there is a high level of availability and up-to-date information, decision-making process is fully effective, and in turn, patients are able to receive high-quality care. Although with the immense amount of data produced each year, it is crucial for it to be organized to allow all-inclusive accessibility. Healthcare analytics plays a tremendous role in decision-making, patient safety, and disease management. In the past years, the use of health information technology among providers has increased significantly. While features of health analytics such as clinical decision support and data mining have been around for years, only has information technologies become more advanced and more available. This integration greatly influences providers, patients, and caregivers to fully understand the data required for treatment, diagnosis, preventative care, and disease management. Healthcare Information and Management Systems Society has defined healthcare analytics as a systematic use of data that are created through analytical disciplines such as statistical and contextual, among the many others, to allow fact-based decision-making for management, planning, and learning. Information pertaining to recent health data and diagnostics can be viewed by all hospital staff from various systems and create a patient's history, including their previous illnesses, blood and tissue typing, chronic conditions, and allergies. Doctors will be able to make more informed decisions about the patient in regards to their treatment plans and care procedures. By putting all this information together on an information management tool, doctors can compare the patient's information to other cases to assess any potential complications.
For the success of technology to enhance collaboration for chronic disease management, emphasis should be placed on supporting organizations and social relationships where the technology will be placed. Healthcare professionals should balance healthcare teams by focusing on the impacts of technology along with both cultural and professional characteristics. Barr et al., 2017. Future areas of research include emphasizing interventions to improve the efficiency of interprofessional collaboration and the use of electronic health records in rural settings where there can be a lack of access to appropriate technologies. Combining the efficiency of electronic health records with utilizing an interprofessional lens will improve chronic disease management.